Lisa, I'm back. We're doing the female aspect of the reproductive system. And now we're going to go through part 6, the vagina. The vagina, aka the birth canal, is dependably about 8 to 10 centimeters in humans. It's distensible, so it can change a little bit from there. It's a relatively muscular tube, and it allows for the discharge of menstrual fluids, bloods, mucus. Also, it is the positioning of the penis here during sexual intercourse, and allows for the capture and partial delivery of semen, as well as a handful of months down the road, the birth of the baby. It is comprised of the outer adventitia, the middle muscular layer, as well as an inner mucosa with a lot of secretive mucus. So it's tilted a little bit towards the back or the posterior between the rectum and the urethra. And it's actually like a really close junction with the rectum. The fornix is the back blind-ended space at the top of the vagina, which extends a little bit beyond the cervix. So like if here's like the cervix here, right, and then up here is like uterus, and then ovaries over here. Like the fornix does this thing where it kind of like gives a little bit of space behind the cervix, and then here's the vagina, right? So that would be that. Okay, the transverse section ridges, also known as the vaginal rugae, are located like kind of just along it, and they um, kind of give a rough kind of territory. They also allow for the extension of the vagina as right. So the transverse section, the lower end, what am I forgetting? Oh, the hymen. Okay, so the hymen is present in many women. So this is the mucosal folds across the vaginal opening. Sometimes they're present, sometimes they're absent, sometimes they are torn. They are oftentimes a mucosal is very thin, and it can be removed by horseback riding, running, sexual penetration, like a number of different elements, and some people are just frankly not born with it. So the vagina itself doesn't have any glands, and so what ends up happening is this thing called transducation. So like it's vaginal sweating is what we refer to it. And so what ends up happening is the cervix will create, it does have, as well as the uterus itself, they will secrete, they have mucosal layers. And so it will kind of move down through its walls, right from the cervical gland above it. The vaginal epithelium itself undergoes metaplasia, which means that it is going to transform from one type of tissue to another. During child, it is a simple cuboidal tissue. During puberty, estrogens are going to transform it into a stratified squamous cell. So it's very, very different. Bacteria are going to be able to ferment glycogen, and that means that they leave a residue of acidity in the vagina, which gives it a little bit of an acidic pH. So that is thought to also inhibit the growth of certain types of pathogens. It has APC, dendritic cells, antigen-presenting cells, which by HIV from infected semen can invade the female body. So that's part of that information. So we'll go through the vagina a little bit more, but I wanted to do an introduction, and I hope that was helpful, and I hope you're all out there somewhere having a great day.